Did you know that according to an article from the American Cancer Society titled Key Statistics for Esophageal Cancer, dated January 19th, 2024, with no author listed, 16,130 people died from esophageal cancer in 2023. That is 22% more than the population of Canton last year. This topic should be important to you because esophageal cancer could affect you or someone you love. The lifetime risk of esophageal cancer in the U.S. is about 1 in 127 in men and 1 in 434 in women, according to the information in the American Cancer Society article titled Key Statistics for Esophageal Cancer, dated January 19, 2024, with no author listed. I have seen the impact of this form of cancer firsthand. I have a brother-in-law who has been battling for the last 6 months the effects of having had esophageal cancer. He has lost over 100 pounds and is being fed via a feeding tube. He has been trying to eat some food, but he ends up aspirating when he does, so they are not sure that he will be able to continue to eat. Esophageal cancer is a complex and devastating disease. To illustrate this, we will look at the risk factors, how it is diagnosed, the symptoms, and the treatments for esophageal cancer. To begin with, we will discuss the risk factors of esophageal cancer. The prolonged use of tobacco and alcohol-related products makes one's risk higher. Barrett's esophagus, which is a long-term reflux of acid from the stomach into the esophagus, is also a risk factor, according to the Memorial Sloan Kettering Cancer Center, with no author or date listed. One other risk factor that I found interesting is not having enough fruits and vegetables in one's diet. Also, according to the American Cancer Society in an article dated January 19th, 2024, with no author listed, obesity is a major risk factor as well. Next, we will talk about the different ways esophageal cancer is diagnosed. Endoscopy with biopsy is one way to diagnose this. It involves putting a flexible tube down the esophagus with a tiny camera on it to take pictures as well as to take tissue samples from the affected area. If the biopsy reveals cancer, then an endoscopic ultrasound may be ordered to get better pictures of the affected area. A PET scan may be ordered as well to make sure that the cancer has not spread throughout the body. Next, we will look at the symptoms of esophageal cancer. One may have trouble swallowing or experience pain when swallowing. Developing a cough or hoarseness is also a symptom. Another common symptom is heartburn-like symptoms, feelings in the chest. Also, a person may drastically lose weight without trying. According to MayoClinic.org, in an article dated January 19, 2022, with no author listed, once a person has developed these symptoms, often the cancer may be in its advanced stages. My brother-in-law couldn't swallow his food easily. He said it felt like it was getting stuck. So he made an appointment with his MD, who referred him to a specialist. An endoscopic procedure was done, and it was determined that indeed he had stage 3 esophageal cancer. Lastly, we will look at the treatments for esophageal cancer. Depending on the stage of cancer, according to the American Association for Cancer Research, in an article with no author listed, published August 17, 2019, surgery will likely be an option to remove the tumor. Sometimes in surgery, part of the esophagus is removed, and then the stomach is pulled up to attach to the esophagus. This is the kind of procedure that my brother-in-law had. He developed pneumonia afterwards and eventually a collapsed lung. Other complications that can happen after surgery are leakage from where the stomach is reattached to the esophagus, infection, and bleeding. My brother-in-law has experienced infection after infection. Often, radiation and chemotherapy are chosen as options, along with surgery or by themselves. My brother-in-law had both radiation and chemotherapy to try to shrink the tumor in his esophagus. Radiation and chemotherapy pose their own side effects, such as nausea, fatigue, diarrhea, and weight loss, according to MayoClinic.org in an article published April 19, 2022, with no author listed. Targeted drug therapy is also an option. Here is a picture of a tumor in the lining of the esophagus and a picture of the tumor down where it's close to the stomach. My brother-in-law, after having experienced several setbacks, will hopefully get to go home soon from the hospital on hospice. Now, the word hospice is very scary. The doctors feel he will get the best care from hospice at home. In conclusion, esophageal cancer is a complex and devastating disease. We covered the risk factors, how it is diagnosed, the symptoms, and the treatments. After researching this topic, I have greater empathy for all people going through any type of cancer. Thank you.